All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the first thing first, and that is about the chit chats. We will be moving chit chats for sure to the cafe channel, the other channel. I'll put the link here in a second, but let me show you why this is important for us to move to the other channel. Here is the last week's, whenever we did the chit chat last time. This is the stats. I think we have about 3,000 views. It shows 1,200, but that's their stat. YouTube stats are all over the place. Uh, Actually, 7 people left, and the total revenue is $8. So, of course, I hope you can imagine that this is not a scalable way, because longer chit chats also, when YouTube sees that the video doesn't earn anything for them or for me, plus when the people are leaving, plus when the views are low, plus when the duration is long, YouTube would then penalize the whole channel and reduce the viewership. So we will move to the other channel where there is not much uh, viewership there. And so if there is any impact to that channel, that is okay. So here I am sharing the channel's link. So 3 more long videos here, and then we'll move on. The other thing I wanted to suggest, that once a chit chat is done and it is up for a week, I recommend that we hide it, so that if anybody has a link, they can watch it. But if the YouTube will not then try to promote it and not get disappointed that people didn't watch it and not penalize the channel. And 1 week, I've seen that most of the viewership is within a week, and then viewership goes flat for the long videos. So what do you think about it? Would you recommend that we go this route? And let me show you now the cafe channel. So this is Cool Beans Cafe. The my suggestion to move to this channel is not to try to get more people over there. It is just to protect this channel that we are working on. So here on the Cool Beans Cafe, and Cool Beans is one word, Cool Beans Cafe Live. If you go to live, this is where you would find our videos. For example, this video is right now live there as well. So I've given you the reason for why, and I hope it is understandable. So with this, I also want to say thank you to Mark and Faraz, who very carefully went over all the chat from the last videos and curated the questions that you had asked, which I had not answered yet. And that actually helped. Although now I have a bunch of questions which I need to prepare and work on. So this week I will not, because I was traveling and I did not get a chance to look and review and prepare for those questions. But from the next time, within the long video, within the chit chat, we'll carve out a section where we'll only answer the questions that were asked before. The only request I have is, please ask good quality questions. Rhetorical questions or political questions, I just don't have good answers for those. So with this, as C Price says, Rumble is great. Yeah. As I promised that in every chit chat, we would at least do some sort of a study together, and then we will do our chit chats too. So today I want to present to you, and the credit for this topic goes to Anne. What I want to present to you is inflammation and dementia. So let's start from understanding basically that dementia can be because of neurological tissues inflammation. Microglia in the brain tissue can participate in inflammation, can cause damage, plus inflammation can create debris and unwanted mangled proteins, which can then lead to dementia. So that is a known problem. The important thing is to realize that peripheral inflammation, that means inflammation outside of the brain tissue. Remember, brain is protected with the blood-brain barrier. So if I have something going on in my body, in theory, that should not reflect on the brain. It should stay, those particles, those whatever chemical substances are going on, in theory, majority of them should stay outside of the brain and not affected. Of course, we know carbon dioxide, oxygen, hydrogen, these can affect the brain tissue. However, I would show you a study today where they looked at peripheral inflammation, that is inflammation in the remaining body. For example, let's say respiratory systems inflammation or genitourinary systems inflammation, and the effect on the brain and dementia. So summary of that is that when we have peripheral tissues inflammation, it does cause cytokine production, which will go to brain and cause the brain tissues decline. And it is a prominent decline. So which means for all of us that anything that causes inflammation to us, we should, as much as we can protect from it, we should do that. There are some of us who have autoimmune diseases where we cannot help with that inflammation because it's just the body is going on with the inflammation. Then we should control as much as we can. So let's look at the study together. So this is drbeen.com. Make sure that you become a member of the drbeen.com. There are 800 or 900 more videos there about cardiovascular system. The one that I really think everybody should look at, if you go to courses and then you scroll down to inflammation, I have just covered a number of inflammatory pathways and how to modulate them. There is one more lecture that will occur this Tuesday, and then this package will be completed. I would request you to get access to this. And the prices are very reasonable. I believe that the price that I take for lifetime is actually sufficient for one video only. Okay, so that is Dr. Bean. Here is the study. This is a study that says systemic inflammation and disease progression in Alzheimer's disease. This study is from Britain. I believe that here, from the Clinical Neurosciences Division and School of Biological Sciences, University of Southampton, UK, Trinity College Institute of Neurosciences, School of Biochemistry and Immunology, Trinity College Dublin, Republic of Ireland, and Memory Assessment and Research Center, Moor Green Hospital, Southampton, UK. Here is what it says. Let me show you the results first. So what they had was they had individuals who were about 80 years of age, who had moderate to severe Alzheimer's, and they looked at they took their blood samples over 6 months, and they monitored them for any systemic inflammatory events, SIEs. For example, respiratory infections or genitourinary infections or other infections. They then measured their inflammatory markers, especially CRP, C-reactive protein, and tumor necrosis factor alpha. Then they also continued to observe them or run the cognition test on these individuals as well. Then they created a plot of what decline or not occurred in these individuals and what was the association with tumor necrosis factor. And then after removing any confounders and after stratifying for age, sex, and other variables, they found a definite link of further decline in cognitive capacity of an individual who had higher tumor necrosis factor alpha levels. In simpler terms, if somebody gets infections which cause inflammatory state to emerge, even if it is temporarily, then the cytokines go to brain and they cause enough tissue, um, I don't want to say damage, but dysfunction, that cognitive decline occurs. And there are many other studies. I just wanted to pick up one study and discuss it. There are tons of other studies that are now showing this research that dementia, one of the reasons is not just the inflammatory state of the brain, but the inflammation in the body. For example, eat a lot of carbs, get a lot of inflammation, and that inflammation would cause decline in the neurological tissue. Anything that produces a lot of reactive oxygen species would cause a decline in the cognitive state of the body. So let's look at this study now. So the background, acute and chronic, let me make it a little bigger. Acute and chronic systemic inflammation. So the keyword here is systemic. They're not looking at neurological inflammation or neurological tissue inflammation. They're looking at peripheral inflammation. Acute and chronic systemic inflammation are characterized by systemic production of the pro-inflammatory cytokine tumor necrosis factor alpha that plays a role in immune to brain communication. Previous preclinical research shows that acute systemic inflammation contributes to an exacerbation of neurodegeneration by activation of primed microglial cells. So microglial cells are present in the brain. One function of them is to provide support and nutrition and health to the neurons. And if you make the microglial cells themselves sick, plus if you have them activated and become participant in inflammation, then the neurons that they're supposed to protect, the neurons would start getting hurt and they would degenerate or they would die away. Objective: to determine whether acute episodes of systemic inflammation associated with increased tumor necrosis factor alpha would be associated with long-term cognitive decline in a prospective cohort study of subjects with Alzheimer's disease. So an important thing is it is in the Alzheimer's disease patients, although there are other studies that show similar effects in healthy individuals. There are many studies that show similar effects in healthy animals as well. Method: 300 community dwelling subjects with mild to severe Alzheimer's disease were cognitively assessed, and a blood sample was taken for systemic inflammatory markers. Each subject's main caregiver was interviewed to assess the presence of incident systemic inflammatory events. Assessment of both patient and caregiver were repeated at 2, 4, and 6 months. It's not a very long time to see the impact of inflammation and cognitive decline. Results: acute systemic inflammatory events, for example, respiratory infection, renal infection, genitourinary infection, etc. Acute systemic inflammatory events found in around half of all subjects that were participating in this study were associated with an increase in the serum levels of pro-inflammatory cytokine tumor necrosis factor alpha and a 2-fold increase in the rate of cognitive decline over a 6-month period. Increased tumor necrosis factor alpha because of infections or inflammation doubled the rate of cognitive decline within 6 months. High baseline levels of tumor necrosis factor alpha were associated with a 4-fold increase in the rate of cognitive decline. So if somebody already had inflammation and they started observing them, they even declined faster. And we're talking 6 months only, showing 4, but 6 months. Subjects who had low levels of serum tumor necrosis factor alpha throughout the study showed no cognitive decline over the 6 months period. Conclusion: both acute and chronic systemic inflammation associated with increase in serum tumor necrosis factor alpha is associated with an increase in cognitive decline in Alzheimer's disease. So very quickly, before we look at some more part of this study, again, we are in a chit chat, so I don't want to make it into a lecture, but just very quickly, just to remind us, remember that the immune system has 2 components, innate arm and the adaptive arm. innate arm has macrophages as part of it. Then it has the natural killer cells that are part of it as well. And then what happens is that when the macrophage become exposed to some foreign agent, some antigen, macrophage would phagocytose that. That means it would eat it up, break it down, then present it on its surface. And then from the adaptive arm, of course, the innate arm would do more things. I'm just connecting them to adaptive arm. This happens within 4 or 5 days. The adaptive arm has T helper 0 cell or a naive T cell. It doesn't know the purpose of its life yet. This T cell will bind with this macrophage and kind of look at this antigen that is being presented. Then this T helper 0 cell, T helper 0, will either become T helper 2 in the presence of interleukin 4 and in the absence of interleukin 12. Or it will become T helper 1 in the presence of interleukin 12 and sometimes also interferon gamma. Although interferon gamma is produced by the T helper cell back towards the macrophage to activate the macrophage. Now, T helper 1 cell in turn will activate the cytotoxic T cell, and then the cytotoxic, this is the cytotoxic T cell. Then the cytotoxic T cell will go and kill other cells, and that is immunity. T helper 1 cell would activate B cell. It would convert a B cell into a plasma cell, and the plasma cell will make antibodies. And those antibodies would go out in the blood circulation and go out in various tissues and fight with the antigen or bind with the antigen. In the case of tumor necrosis factor, macrophages produce tumor necrosis factor. Natural killer cells produce them. T helper 1 cells produce them primarily. Then damaged blood vessels produce them. You may know that nowadays a pandemic or epidemic of vascular inflammation is going on. So endothelium produces it. Then other inflamed tissues can produce this as well. Interestingly, tumor necrosis factor does not get produced only because there is some infection that is present. Tumor necrosis factor can be produced by these cells even when we have stress on us. Tumor necrosis factor is also produced when we are obese. So obesity has a strange double whammy with us. Number one, inflammation, extra carbs, extra calories can lead to obesity. Then obesity or the adipose tissue, the fat tissue, can start producing inflammatory cytokines like tumor necrosis factor, leptins, and others, which can then keep the body in an inflamed state. So it becomes self-sustaining, not for itself, but for the whole body to produce chronic inflammation. So many of these, cigarette smoking can cause that as well, production of tumor necrosis factor. Stress can cause that. Surgeries can cause that. Infections can cause that. Anytime when there is a tissue injury, that can cause that. So whenever our tissues are under stress, they can start producing, and the immune system can start producing tumor necrosis factor alpha. And as you're seeing here, the tumor necrosis factor alpha, once it is produced in the body, so let's say if this is a person, so let's see if I can make a person. So let's say this is a person, and the brain is protected by the blood-brain barrier. This is not beard, this is blood-brain barrier. But if that person has inflammatory state in the periphery, then the tumor necrosis factor can enter the brain tissue through the blood-brain barrier, activate the microglial cells here, and then cause inflammation of the brain tissue as well, and neurodegeneration that can lead to exacerbation of Alzheimer, for example, and that can lead to cognitive decline as well. So this is the mechanism. Just a few more things to see here. It's a long, beautiful study. I don't have time to go over all of that. But if you see, for example, let's look at some infections. Respiratory system infection. If you see here, the last column that says effect size mean difference, and then ADAS cog change. So Alzheimer's disease cognitive test, if the number are higher, that means the decline is increasing. If the numbers are lower, that means decline is reducing. So this is a test where higher number is bad. So here 2.6 was the number that increased. That means cognitive decline increased. And 1.0 here in the bracket is the error that is possible. So it could be 3.6 or it could be 1.6. Similarly, genitourinary infections, infections of the genital tracts, infection of the urinary system, kidneys, urethra, etc., 5.9 point difference. And then 1.8 is the margin of error. Then accidental trauma, 9, and if you look at it, 2.4. Then gastrointestinal infection, look at the number for the GIT infection, 6. Why? Because there is going to be microbiome that are going to be disrupted as well. Number 2, GIT is a very large organ. It has a huge number of immune cells present in it. So when the GIT is infected or inflamed, that has a bigger effect on the whole peripheral system, the body, and then on the brain. Other infections, 5.4, surgical intervention, 3.5, myocardial infarction, 4.0. So this is how badly these stresses and infections affect our cognition, or patients with, in this case, patients with Alzheimer's disease is cognition. Then there are many other interesting things. For example, here, systemic inflammatory events, or SIEs. Subjects with one or more SIEs during the 6-month follow-up period had an increase in tumor necrosis alpha levels compared with subjects with no SIEs over the 6 months. Then the mean change in ADAS COG score over the 6 months follow-up period was 2.6 and standard deviation 7 points. And here you're seeing this red line is when the patient did not have any inflammatory events. And if you see here, they have a lesser decline. Of course, these are patients of Alzheimer's disease. They may have decline in general as well. On the other hand, if you see that if they also have inflammatory state events, then look at the decline, which is greater than the regular progression. Same thing over here. This is the high tumor necrosis factor alpha SIE present in 82. Look at how much is the decline. This is 0. If we go above, that is an improvement in cognition. If we go below, that is a decline. And by below, the higher number. So I should rephrase it. If the number is in negative, that is improvement. And if the number is in positive, that is a decline. So if you see here, this is a decline. In total, 34 of the 59 subjects at baseline with low serum tumor necrosis factor alpha levels had serum tumor necrosis alpha level that remained at less than 2.4 picogram per milliliter during the 6 months follow-up. Examination of those 34 subjects with low tumor necrosis factor alpha throughout the course of the study showed them to have markedly lower rate of cognitive decline compared with those with high tumor necrosis factor alpha. Look here, these are the SIE absent. They went down, went back up, but SIE present. Look at the decline. And then there is more which I have marked, but I would spare you further discussion here. And if you wanted to see the author's disclosures, Professor Holmes has received research support from the Alzheimer's Society. Then Dr. Cunningham has received non-industry sponsored funding for travel. Then Dr. Professor Perry has received honoraria from Danish Research Council, etc. So although this study is for Alzheimer's patients, but it shows an important thing. Inflammation in the body can affect our brain tissues function. And remember, when we lose a neuron, we lose it. There are neurons in the hippocampus that can be regenerated. The brain has plasticity as well, that the remaining neuron can then learn to perform the action of the neuron that died. And there is a hint that there may be more stem cells within the brain that can give rise to more neurons. The problem with the neuron regeneration becomes that how do you connect the neuron in the same wiring system where the previous one was supposed to be attached? And that's a difficult problem. So the best is for us not to lose our neurons. And I remember once I did a study, and what I did was I turned the lights off, like I can do right now. Alexa, turn off the camera. So when the lights are off, you are looking at a different scene which might surprise you. Surprising your brain can actually activate the neurons and make them healthy. Alexa, turn on the camera. So just simple exercises. Rigorous exercise can also produce tumor necrosis factor alpha. So simple exercises, less stress, which is a very bad thing to say. To tell someone that, hey, you should relax would actually make them stress further. But whatever way you can relax, make sure that if you can laugh, if you can be happy, if you can listen to some music, whatever makes you happy, try to do more of that. Try to accumulate those events around you because it is important for your brain's health. And then, of course, stressors of any kind would produce tumor necrosis factor alpha, which also causes neurodegeneration. So let's just protect ourselves from that. Okay, so this is it. This is the study I wanted to share. Alexander says neurogenesis. Neurogenesis is possible. For example, our hippocampus produces about 500 new neurons every day. And of course, there are older neurons that perish as well in hippocampus. So neurogenesis is possible, but so far the research has only shown smaller focal areas in the brain where it is happening. They're trying to figure out, is it possible in the remaining brain as well? And as I said, Alexander, the problem is how do you reconnect them into the same wiring where the previous one was attached? However, we should try our best to reduce neurodegeneration, right? Inflammation control, reactive oxygen species control, mitochondrial dysfunction control, reduced nitric oxide levels control, all of those would help. Reduce carbohydrates. And again, I said that last time as well. You reduce carbohydrates, you go plant-based, or you go keto, or you go omnivore or carnivore. But the basic idea is, how do you reduce inflammation? And for the medical professionals, where this is a very common practice in the US, that when somebody gets an infection, we say, let your body fight it first. I don't want to give you anything to help it. Maybe just take some Tylenol. Remember, the more and the longer you expose a patient to an infectious state, the more you allow their body to fight, which is fine, they would be exposed to a longer duration of inflammation. And that would cause, at least in some patients, as you're seeing here, cognitive decline. So you have to walk a tight rope for how much antibiotics to use or how much anti-inflammatories to use, while how much to protect the patient as well. So Anonymous says, how do you increase the gray matter in the brain? That is what I was just talking about. There are, hippocampus can have neurogeneration, but it does not increase the gray matter. It would, there are, let's say, 512 neurons that died, and then 512 will be made. So I'm not aware of increasing the gray matter. If there were things that would increase the gray matter, then that could actually put us at risk of making too many neurons. However, neuronal health is possible, and these are some of the things that I just mentioned. Muhammad says that I saw this famous video that shows generation of neurons while we are discovering new things. Absolutely. Absolutely. Anytime you surprise your brain, anytime you feed it new things, just look up at the stars. And if that is something surprising or fun for you, that would help you have healthy neurons or even generate them. Anonymous says any correlation between shrinking of gray matter and thinning of hair. So the thinning of hair and shrinking of the only, if I go and try to, um, pull on some strings to connect them, would only be if there is a inflammatory state or vascular inflammation that would reduce the blood supply to the hair follicle, causing them to malfunction, could also affect the brain as well. Correct. John says, like telling someone with insomnia not to lose any sleep over it. Correct. So it is kind of from a medical point of view, from me as a doctor point of view, it is kind of a cruel thing to tell someone to relax. It is not as easy. If you tell me if I'm stressed, let's say for something, and you come in and say, you know what, hey man, just relax, calm down, that would actually stress me even more. Everybody is different. Maybe there are people who can then switch off when you said, hey, relax, and they just started relaxing. It would actually stress me out more because now I have a duty of relaxing as well while I'm handling the stress. So, relaxation, we should all know what helps us relax, and everybody is different. Somebody would like to be in the plants and the trees, and they would relax. Somebody would paint and relax. Somebody would listen to music. Somebody would be with their family and friends. So everybody is different. So the best way to help someone or yourself is to find out what relaxes you and then to practice that more often. Alexander says journaling is great. Absolutely. So I did not used to do journaling. And then my wife asked me that, hey, I journal and it is really relaxing. So today, actually, it's so funny that you brought it up. Today, I had my iPad over here and I was journaling today. So it is actually interesting. Okay. So now, if you have a question, then please do me a favor and put some QQQ so that I can look at the questions. Otherwise, I kind of have to scan through all the comments to see if there is a question, and that is less efficient. Odette says, your wonderful painting. All right. So, do you guys want to see my paintings? I have them over here. So, this is a new painting I did, although not the best, but still, for me, it is a new painting. There is a near my home. There is a place on the mountains called Russian Ridge Mountains or something like that. And I go there, I take pictures, and then I try to paint them. This is something I showed you last time as well. Tiny paintings, more paintings. This is another painting I did. And maybe three more. This is one more painting. And then this one maybe a slightly more chaotic, but this is a painting of a slightly cloudy day. And finally, this is a painting I'm not super excited about. Do you see these little blobs? They are so symmetrical. So I'm not super excited about them, but this is a painting that I did as well. So here we are with the paintings and stuff. I'm going to share with you that link. I hope I still have it in here. This is the link for Cool Beans Cafe. Please make sure that you look at it. Three more lectures here, and then we will move entirely to the Cool Beans Cafe for live lectures. And these live, I want to have your opinion. Is it okay if I hide the previous two chit chats because they are kind of impacting the channel negatively? Usually, whoever is going to watch, they watch it within a week and then they move on. So Andy says, what were the supplements that could be taken then might reduce tumor necrosis pathways. So there are many supplements that can help with the TNF alpha. But because TNF alpha is so commonly secreted or released by so many other tissues, for example, blood vessels. Actually, let me show you this and let me answer this question. Controlling inflammation, whatever way you can, is that the curcumin or is that ashwagandha or is that the EGCG or what is that? There is boswellia. There are tons of things that can help with the inflammation. Or if you use allopathic anti-inflammatories, point is to keep inflammation controlled. And if you have been with me since through the COVID time as well, you would know that I kept saying the most important thing to reduce tissue damage is to control inflammation. Many times, doctors would not control inflammation because they want to understand what is causing it and they want to go to that root to eliminate that, and that is excellent. However, in the meantime, when the patient is going through inflammation, their tissue damage is occurring, and it is our responsibility to help them reduce that as well. So let me show you as part of this question, there is a link I have over here, the role of tumor necrosis factor alpha in autoimmune disease and current tumor necrosis alpha inhibitors in therapeutics. So good question, and that was a good segue for me to come to this one. Tumor necrosis factor alpha was initially recognized as a factor that causes the necrosis of tumors when it was found, but it has been recently identified to have additional important functions as a pathological component of autoimmune disease. Tumor necrosis factor alpha binds to two different receptors which initiate signal transduction pathways or inflammatory pathways. These pathways lead to various cellular responses, including cell survival, differentiation, and proliferation, all good things. However, the inappropriate or excessive activation of tumor necrosis factor alpha signaling is associated with chronic inflammation and can eventually lead to the development of pathological complications such as autoimmune diseases. And then they say currently clinically approved tumor necrosis factor alpha inhibitors have shown noticeable potency in a variety of autoimmune diseases, and novel tumor necrosis factor alpha signaling inhibitors are being clinically evaluated. So if I go down here in this one, there is a diagram here. Look at this. Blood vessels can release tumor necrosis factor alpha. Macrophages can release tumor necrosis factor alpha. T helper 1 can produce tumor necrosis factor alpha. And so there are even those joints, people with arthritis have lots of tumor necrosis factor alpha, which that means if I extrapolate from this study that we saw for the Alzheimer's patients, which means that, and this is my opinion, this is not the study, that if TNF alpha is increased because of arthritis, then that would go to brain as well and cause cognitive decline as well. So if you see here, TNF alpha is mainly secreted by macrophages and T helper 1 cells. In rheumatoid arthritis, tumor necrosis factor alpha activates synovial fibroblasts, which cause the overproduction of cathepsins and MMP, or cathepsins and MMPs, etc. So thank you for this question. Suits says, and paracetamol's regrowth of NMDA receptor sites after ethanol abuse, how useful have you found it? I have not had a direct exposure to that. I'll have to look into this, especially with the ethanol abuse. Lady says, Lady G, what helps me is listening to wave sounds on YouTube as I have tinnitus. That is actually very, very important. Alexander says, red light therapy or going into full sunlight is good to reduce inflammation. Red light therapy is very, very useful. Anonymous is talking about grapefruits. Let's see if there are other questions or if we should then hang up if there are not much questions. So Lady G says painting is relaxing. Are they acrylics or oils? So I started doing acrylics because these were water-based and easy to, wash. But they dry so fast and they change their value a little, and I could not handle them. So these are all oils, although these are water-based oils. So I like their the benefit of cleaning the brushes with water, but I also like that they stay kind of fluidy or wet for a longer period of time. I did this painting, I think, a week or two ago, and it is still slightly wet. So, uh, water-based oils. So this is the discussion. Any other questions, comments? So Andy says, interesting. My mother passed of vascular dementia, which is probably quite a different pathology, but had T2D and RS. No, not really very different. The type 2 diabetes mellitus causes vascular inflammation. That is how um, so when the foot drop or the diabetic foot occurs, for example, the reason is twofold. One, the immune system itself is not fully capable of handling infections because immune cells are not functioning correctly because they got glycated. And I explained glycation in a few videos before. The second problem is that the vascular endothelium becomes inflamed because it also gets glycated, and glycated vascular endothelium cannot function correctly, and so it starts becoming inflamed. And when the inflammation occurs in the blood vessels, number one, thrombosis can occur. Number two, the blood vessel walls start becoming inflamed and have plaques in them, and vessel obstruction occurs. More delicate vessels start bursting. So vascular damage with type 2 diabetes mellitus is very, very common and important to know. Similarly, the other thing that you had said, where was it? Um, Sorry, I just missed the second part. But that was also, yeah, so rheumatoid arthritis. And as I just said, RH, arthritis of any kind, which would cause the joint pains, would cause inflammation, which would create tumor necrosis factor alpha. Tumor necrosis factor alpha can be produced by the cells that are under stress. So, not just the cells. If we are under stress, psychological stress also increases TNF alpha production, which produces the inflammatory state. And then we know that stress also produces the stress hormones, which would also create inflammatory state. Odette says, how do you sell your paintings, Dr. Bean? I would love to sell them. I think that they are not good enough to sell. For example, if you are a painter, you would see a lot of gaps in this painting. It's not, from a painting's point of view, not a very good painting. But I just do them because I like to do them and I like to learn painting. So, if with this risk that the paintings are not the best, sure. Suits says, night. I'm still watching, a bit behind because I had to share. No worries. Thank you very much. Cheryl has a question. Um, Cheryl says, place your oil painting in the back window of your car. The heat will dry it much faster than any other way. I speak from experience, even in the colder weather. That is amazing. Okay, sure. I'm going to start doing this. Very good point. Odette says these are good enough to sell. Okay, then they are ready to be sold. Lady G says, are you familiar with D Manos for UTIs? I found it works well, also good for E. coli. Unfortunately, our food has been compromised. I was not, I know that Manos can help, but I did not know that this much. And I think that GIT health, so you're talking about urinary and GIT, but GIT health is very important as well. Because if we bother our microbiome, or if the GIT lining is bothered, that can throw out the whole immune system into a chaos and cause inflammation. Pat says, going to watch your A Simple Plan to Control Inflammation. Thank you for teaching. Absolutely. And I think we all owe it to ourselves to understand what is inflammation and to understand how do we control it. How do we control it with lifestyle, with uh, things that improve our psychological health, with food, with supplements, with allopathic medicines, with other whatever you believe in. Know what causes reduction in your inflammation. That is your key for healthy lifespan and healthy life. Teresa Ramanga says, I got a UTI and it was so pain. Absolutely. UTIs are very painful and irritating. Gypsy says, hello, fine Dr. Bean. Hello back to you, Gypsy. How are you? Uh, I, a Music says, hi, so arthritis or any pain would be a factor of my decline of mental health. Yes. Meaning, I can't say to a person to generalize it to say you would have it, but any pain, there are two problems with the pain that would cause inflammation. Number one, the pain actually means there is inflammation going on somewhere, and that means there are inflammatory cytokines being produced. And secondly, pain causes stress, and the stress itself then produces inflammation. So, double whammy with pain. Um, Run Death is Near says, question faded, not fainted picture. Okay. Andy says, thank you so much for your answers and explanation and tuition, Dr. Bean. You're very welcome. Steph says, what do you think about the blue light connect? The Okay, can you hear me? Can you hear and see me? I think there is a network issue going on. Let me type something. Okay, good. Nipa, welcome. Sigrid says no audio. You're back. Yeah, so I saw a temporary, I hope it is temporary and doesn't happen again. Uh, so near infrared light is very important for brain health. Morning walk, where the sun is not right at our head, morning has more near infrared light. Evening walk has more near infrared light, and near infrared light lamps. They would not have light in them. They are kind of near infrared. The near infrared light can penetrate up to 4 inches through the bones and the clothes. And what it does is, I had done this discussion before. Let me very quickly uh, show you how it works. Can you see me? So I hope you can see me. So here, let's say this is inside the mitochondria. This is in, so if this is a mitochondria, we are seeing somewhere over here. It is a network issue. I'm sorry. So inside the mitochondria, there are millions of electron transport chains, right? So these are complex 1. This is a chain itself, complex 1, complex 2, then complex 3, complex 4. Then they're connected with a physical motor called physical, actually motor. You can actually Google right now the rotations per minute of ATP synthase. ATP synthase. I believe it has more than 3,000 rotations per second or per minute. RPM per minute. So this is the electron transport chain. This is the ATP functioning, forming motor. Electron transport chain, the complex 2, the one that also has CoQ10 in it, this complex can leak reactive oxygen species. Complex 4, this complex, it's really, really important. Complex 4 is said, we are looking inside the mitochondria. Complex 4 is said to either manufacture nitric oxide or attract nitric oxide that binds with it. Imagine like a little magnet that is a magnet for nitric oxides. So it holds on to the nitric oxide. Some literature says it makes that, some literature says it grabs the nitric oxide that is present in the environment and that it sticks it with itself. Now, what happens is the mitochondria complex 4 can release nitric oxide when it needs to. So the question is, when would it need to? So let's look at it. Let's say this is a tissue. And of course, every cell has thousands and thousands of mitochondria, and the tissue has millions and millions of cells, correct? Imagine that this tissue has a problem with the blood supply. Maybe the blood vessel is inflamed. Maybe there is atherosclerosis going on. Maybe there is diabetic damage going on. Maybe there is some other reason, infection, virus, something that is causing blood vessel to be inflamed. When the blood vessel is inflamed, the nutrition to this tissue is reduced, oxygen supply is reduced, and similarly, the clearing of the garbage or the waste products is reduced as well. Clearing of carbon dioxide is reduced as well. Creatine is produced that is also not getting cleared. Phosphates are produced that are also not getting cleared, and they would cause acidity in the environment. The other pH lowering substances would start accumulating as well. The result of that is that if the cells have healthy mitochondria, their complex 4 would start releasing as soon as the mitochondria would sense that the nutrition is less. Why? Because mitochondria itself is working with making ATP. It knows how much nutrition and oxygen is available because it uses them to make energy, ATP. So when the mitochondria senses that there is less ATP production because there is less nutrition and less oxygen, it immediately starts releasing nitric oxide. That nitric oxide would then go and act on the blood vessels and dilate them. And dilated blood vessel, in theory, would, if it gets dilated, would bring in more nutrition and more oxygen and wash away more waste products and more carbon dioxide. So this is how a mitochondria, a healthy mitochondria, can actually help the tissue modulate the blood supply that is needed for its function. Now imagine that the mitochondria is sick. Somehow the electron transport chain is not working correctly. That means that the complex 4 is not working correctly as well. Guess what can help this? Near infrared light and methylene blue. Near infrared light can actually shine on complex 4 and directly provide it the photons that it can use to start kickstarting the ATP synthase plus start releasing the nitric oxides. Methylene blue actually affects the complex 2 and complex 4, and methylene blue is a donor and recipient of electrons, so that's a very different mechanism, but still that helps with the mitochondrial health as well. And they actually did a study of administering methylene blue to individuals who had fresh stroke. And they found that the individuals who were taking methylene blue right in the beginning of the stroke had lesser damaged areas. So the amount of damage that occurred was lesser compared to those who did not have methylene blue. So methylene blue help produce more energy, help bring the mitochondria towards health, and result was that most of the tissues around the damaged area would stay healthy and not succumb to the hypoxic conditions and to the damaging inflammatory cytokine conditions. So the near infrared light is really healthy for brain tissue health. So I hope that was a good question, whoever asked that. Suit says it's got so many awesome animations for ATP synthase, cell biology lectures. Love them. Um, very good. And I did a series on this. John, you are very correct. Methylene blue has an affinity to the neuronal tissue, then it has an impact on the betterment of mitochondria. So, what happens is that when the tissue, imagine that one tissue is affected by stroke. Stroke will mean that there is less blood supply, there is hypoxia, there are ischemic conditions, there is damage that is happening, which means that it can now spread out to the neighboring cells as well, because those inflammatory cytokines are affecting them, less blood supply is affecting them. So if you give methylene blue, those uh, target those cells that are healthy but can succumb to the uh, tissue that is getting damaged. These stay healthy, they survive better. So Doreen says that that is an awesome find using the light found by accident. Most of the findings are by accident. I'm not sure how the original study was done for the effect of the near infrared light, but these are the studies that show that near infrared light, when shown on the neurological, actually anywhere, it helps with the mitochondrial health, especially for the brain tissue as well. Um, Artifact in reality says what is methylene blue. So methylene blue is of two types. One is industrial methylene blue, that is used, number one, for biochemical labs where we use methylene blue to stain the tissue. Methylene blue is also used for staining things with blue color. That is a completely harmful stain for us to ingest. But there is methylene blue that is pharmaceutical grade as well, and that can be found over the Amazon. And the methylene blue is used for some poisoning as well, with, I believe, carbon monoxide. The methylene blue in very tiny doses is, the studies have shown, healthy for mitochondria as well. John says, thank you. You're very, very welcome. Uh, Les says, astonishing to learn up to thousands of mitochondria. Actually, let's see how many. If I said how many mitochondria are in a cell, the number of mitochondria in a cell varies greatly depending on the cell type, but most cells contain hundreds to thousands of mitochondria, with the cells like liver cells having around 1,000 to 2,000 mitochondria per cell due to their high energy demand. So, generally, if a tissue needs more energy, then of course it needs more powerhouses, and the mitochondria are those powerhouses I was reading here. And if a cell does not need a lot of energy, then it would have less mitochondria. Faraz says, is this a regular slot for your chit chat lectures? Yes. So we have decided to do chit chats on Friday evening at 6 p.m. Although we are trying that after three more lectures on the Dr. Bean side, we'll move to cafe side, but this is a slot for chit chats. Yes. Muhammad says, sunglasses. It's true that that's not healthy. No, sunglasses, as far as I know, they're actually very protective for the eyes. Nipa says it is used to treat pus in kidney in homeopathy. Um, Run Death is Near says, I'm having to help elderly whom have had strokes after COVID vaccines. I don't think they'll take CBD oil. Could you please find some detox for next time and teach us? Um, okay, I'll discuss. Although I've done tons and tons of talks on these topics. Odette says, where to find your talks on reducing inflammation? So let's actually go to this place. If I say youtube.com Dr. Bean, And then if I go to Dr. Bean Medical Lectures, in the videos, the how to reduce glycation. Glycation causes inflammation. So this is that video. Then um, stop eating French fries or the fried foods, which is also, these are also inflammatory. So this video is also about reducing inflammation. Then over the counter therapies for inflammation. I think this is something that everyone should know. And it's only what? It's a 9 minutes video. Then IL-12, IL-11, inflammation beats cholesterol for cardiovascular event. I did this video that cardiovascular events, if somebody has inflammation, higher inflammatory markers lead to more cardiovascular events compared to higher cholesterol levels for people who are on statin. I did that discussion over here. Then a simple plan to control inflammation is an important video. The vitamin D may reduce fiery death. This is also, fiery death is the pyroptosis, which is also inflammatory state where the cells die by producing inflammation for their neighboring tissue. So they themselves die, the cells, but they cause inflammation of the neighboring cells. And so that whole thing just keeps propagating. So that is called pyroptosis. There is another, so the cell deaths are apoptosis, pyroptosis, ferroptosis, and the autophagy. Then omega-3 reduces chronic inflammation, main supplements to control inflammation, and then omega-3 and omega-3 sources, omega-3 and omega-6 ratios. These are all, if you see here, 1, 2, 3, 4, 5, these are all anti-inflammatory or inflammation controlling videos. I am surprised I've done so many now. I think there may be some in the live as well. But at least on the recorded side. So if you go to the channel, you'll see videos, shorts, live. The live lectures are here. And then in the videos, you would see many of the uploaded videos for inflammation. Teresa among us says, make a playlist. I think I have a playlist for, so if I go back here, and if I go to playlists, there is a playlist that says nutrition and aging. Maybe I should call it inflammation. This one has these videos in it. See? Already on top of it. Odette says, thank you, you're very welcome. What else is there? So Steph says, what do you think about the synthetic vitamin D cholecalciferol? It is good. Vitamin D, synthetic or other. Of course, some people like more natural stuff, and that is fine. Otherwise, synthetic is good as well. Okay, this is a very good question. Cheryl says, what is the difference between far infrared and near infrared? So, you ready? It's a good question. I will translate that question into what is the difference in the light that causes heat production versus light that does not cause heat production. Near infrared light does not, it is not thermal. The maximum temperature rise that it can do is about 4 degrees. On the other hand, the thermal light can actually keep increasing the temperature because it brings in so much energy. So the question then becomes, light that causes heat production versus light that does not cause heat production, what are the uses of these? Both can be beneficial and both can be damaging. For example, if you have heat producing light, let's say for sauna or heat lamps, if you use them for a longer period of time, the tissue would get damaged. Similarly, if you have near infrared light, which is non-thermal, but you keep shining it for more than 15 minutes, it actually causes reversal of its effect. And there are medical mechanisms that show that some therapies can reverse their effect at a higher dose or longer duration. So get ready for the difference between them. It is such a beautiful topic. I can speak for it for 2 or 3 hours, but let me see if I can summarize it. Heat producing light activates heat shock proteins. And let me share them as well, share my screen. So this is a good question. I think we should every day, with every chit chat, we should have a award for questions. So imagine that this is a cell, and imagine that this cell is like a little city, a cell that undergoes a stress. The very first time they found this was that they had a bunch of cells in a petri dish outside the body, and they heated them. They were just the scientist was just trying to figure out, if you heat a cell, what will happen. And they found out that a new breed of proteins were formed inside the cell. And so you might say that, how were they just formed? Why were they not already there? Our cells are very efficient with their resources. They do not just make junk things and keep them around because we will need them. Instead, what happens is that whenever cell is in a certain state, it will open up the genes that will manufacture proteins that are useful for managing or handling that state. So when the cells got heat on them, when they were heated, the heat sensors in the cell told the nucleus that, hey, we are hot. And the nuclear genes opened up that produced a special kind of protein. Remember, the gene would open up, and then there will be mRNA produced. mRNA would come out, and that would go to a ribosome, and the ribosome would make the protein itself. These proteins, they named them heat shock proteins. Heat shock proteins. Why did they name them heat shock or HSPs? Because they observed these proteins when the cell was shocked with heat. It turned out later on that the heat shock proteins are actually produced anytime a cell is under stress for whatever reason. That stress could be that cytokines from outside are stimulating the cell and telling that, hey, you're going to be under stress. Your neighboring cell is dying with some infection, and soon you're going to be under stress as well. For example, interleukins or tumor necrosis factors, etc. So that is a stress. A cell can be under stress if you tug it and you physically stretch or skew it. That would produce the stress signals to be activated. The cell can be under stress if there is more acidity around it. A cell can be under stress if there is more alkalinity around it. A cell can be under stress if there is some virus that has entered it. So there can be multiple reasons for how the cells can undergo cell stresses. And actually, you would probably appreciate this. In the inflammation on the Drbeen, if you see, there is a lecture, Cell Stresses. This lecture about cell stressors, states, and fates, where I have, in 1 hour and 12 minutes, I have discussed what are the general stresses on a cell and what happens to the cell under those stresses, what are the state changes of the cell, and what are the fates of the cell. I believe that this $97, for which I sell all these 800 videos, just this one video is worth 97 or more. So anyways, back here. So when the cell is under stress for any reason, it starts producing heat shock proteins. The function of the heat shock proteins is to pick up any trash inside the cell. This is very similar to, remember when we say that, well, let's say Florida, there is going to be some hurricane. What happens is people would start protecting their house, and they would start picking up things and put them somewhere. They'll do preparation. Similarly, when a cell has their heat shock proteins activated, like a fire brigade activated, the heat shock proteins function is to start picking up the trash in the cell, which may hinder with the cell's capability of handling the stress. Plus, they would start eating up these trashes so that they can recycle them into making energy and put a bunch of batteries and energies in the cell for the bad times that are coming. This is very similar if you tell to a community that, hey, your power will be out for the next 3 days. So either go away from here or make sure that you have enough batteries and stuff available and then enough food available. So the heat shock proteins are going to recycle the tangled messes of the trash proteins present in the cell and recycle them to make energy and to make those amino acids or other components available to make other type of proteins when the cell is going through this stressful state. So, so heat shock proteins end up, when they become active, they end up cleaning up a cell, providing it with energy from its trash and creating ATP, layers and layers of ATP for its function. The most important thing is that cell's trash is removed. The only other way to remove this trash is to trigger autophagy. Heat shock proteins do that too. So your question that if there is, again, I'm rephrasing your question. If your question that what will happen with the heat, the light that gives us heat, the light that gives us heat, for example, saunas or a little more higher uh, um, sun or a heat lamp, taken for a dose where the light or the heat is not sustained on the cell for so long that the cell dies. If that is not happening, then the cell would actually become cleaner, healthier, full of more energy, and full of recycled material that can be used to make other good things in the cell. So that is the benefit of heat shock proteins and the benefit of hot light. That may be, as I said, from sauna, from sun, from lamps, whatever way it is. On the other hand, near infrared light does not produce heat, so it does not activate heat shock system. Instead, the near infrared light works on the mitochondria and makes them healthy. So that means for us, it is important that every day we get near infrared light, 10 to 15 minutes every day, and we get heat shock therapy 10 to 15 minutes every day. There was a study that I discussed during COVID times where they showed that if you take near infrared light lesser than 10 minutes, it has no benefit. It does not activate enough of the mitochondrial health that it becomes useful. So 10 minutes and above. And they also said that if you take, for example, heat shock, that is sauna type things, or hot light for more than 15 minutes, that causes tissue damage instead of just providing help. So I have tried to summarize the heat shock protein. Heat shock proteins, or HSPs, are, we say, they are chaperones. Chaperones mean helpers. They are helper of a protein, any other protein in the cell. Cell is filled with proteins and enzymes that are functioning, right? Cell is a machine which has a lot of things in it, that gears that are working. Heat shock protein are the chaperones of the other proteins from the inception, from their birth till their death. It is actually the heat shock protein that remember when the ribosome is making new protein, when a baby is born, the baby is caught, is collected in a heat shock protein. It becomes the incubator of a newly born protein, and it allows that protein to live in that incubator for a few moments so that the protein can take its correct shape. Then that protein is released in the environment of the cell to go do its function. Then when the protein is functioning, we eat stuff and we do things that produce reactive oxygen species. Those reactive oxygen species attack the little innocent enzymes that are working around, and the enzymes become all out of shape. Guess who comes and helps them again? Heat shock protein would come in, engulf them again, give them an incubator to correct them back to health. If these proteins cannot be brought back to health, then the heat shock protein is going to mark it for death. and it would activate ubiquitination mechanism, which is the protein death mechanism, where another set of proteins or worker proteins would come in, pick up this mangled protein and destroy it. They'll take it to the endosome and proteasomes, which would then shred them and take the amino acids or the bricks from them and reuse to make more proteins. So heat shock proteins are the chaperones from inception, from cradle to grave of a protein. It is the largest protein management hub within a cell, and it is activated by stresses of physical stress. For example, if you do exercises, you would activate heat shock proteins. If you have hot environment, it would activate heat shock proteins. And near infrared or cold light, on the other hand, activates the health of a mitochondria. So Ari says, could you repeat the comments on controlling the inflammation after a heart attack as compared to with taking statins? You've had several great points today. So let's talk about it. There was a study that I discussed in that video I just showed you. In that video, what I discussed was a study where there were people who have had cardiovascular events who were on statins already. Then they started monitoring these individuals to see two things in them: what is their cholesterol level and what is their inflammatory state. And for inflammatory state, I believe they used high sensitivity CRP level, C reactive protein levels in the patient's bloods. Then they monitored them for any other cardiovascular events that could occur. Patient already had a cardiovascular event, was already on statin. Statin itself is anti-inflammatory as well. Then they're looking at their cholesterol levels. You would think, or general thought, what media has produced, what big pharma has produced, what medical community has produced in our minds is that higher cholesterol mean worst outcome for the cardiovascular system. Interestingly, higher cholesterol did not have as much damage or contribution to next event, cardiovascular event, as higher inflammatory state was. Higher inflammatory state, I believe, had multiple times more risk for cardiovascular outcomes, negative outcomes, compared to higher cholesterol. So that is the video I did, that inflammation beats cholesterol when it comes to cardiovascular events. Paul Wolf says, great summary. Thanks. Never really understood the difference. Thank you. You're very welcome. Les says, does temperature elevation from exercise have a similar benefit? And how about a hot shower? Hot shower would activate heat shock proteins. Exercise itself would activate, it doesn't have to be hot. It would activate the heat shock protein, because with exercise, you are, so let me show you one more thing, which is such, medicine is so interesting that we should all just study medicine. So I wish our doctors study medicine with a little more zeal and zest as well. So here is a cell. Let's say this is a muscle cell. And this is true for all cells, but it's easier for me to make it in a muscle cell. All of our cells have a cytoskeleton. Cytoskeleton means there are microtubules that are attached to various parts in the cell. Just like, within the walls of our houses, or our house, there are those planks, right? So these little frameworks that are present, and then we put the walls, etc. Our cells have microtubules as an infrastructure. A cell is not a bag of fluid and organelle. A cell is a very structured entity in which there are other organelles and fluids that are present. So the structure is given by microtubular system. It's the infrastructure of cells building. When our muscle cells, for example, when they move, what happens is, imagine that this muscle cell elongates. When it would elongate, of course, the diameter would reduce. And that would cause these, let's take this microtubule here. This microtubule would now become stretched. It would change its angle. So over here, the angle was whatever, X. Over here, the angle is Y. This angle of the microtubule, they have little sensors attached here with the microtubules to monitor their angles. Those angles information is sent to the nucleus. So when the angle information is provided to the nucleus, nucleus now knows that the cell is stretching or skewing and the cell is moving. And then the nucleus would produce a bunch of other proteins that would then help the cell do its function because it is working right now. For example, glucose transporters would be emerging on the cell surfaces to allow more glucose to come in even without insulin. Similarly, heat shock proteins will be produced to help the cell when it is moving around and is stressing out because you're exercising it. Heat shock proteins would be made, and their job, heat shock protein doesn't know that you're intentionally doing an exercise, and so they can sit around and watch TV while you do it. Heat shock protein would just go to their work. What is their work? Start picking up the trash and start making more energy and start cleaning the cell. So even if you don't produce heat when you are exercising, just the action of moving your muscle, changing its shape. So, for example, when you contract the muscle, the same muscle cell would now become more fat and short. And once again, we talk about the same one microtubule, the angle would change again. That would tell the nucleus to have glucose transporters moved up and to produce heat shock proteins. Heat shock proteins are just going to say, all right, we are going to pick up every piece of trash and convert that into amino acids, which are useful bricks for the cell to use, and we're going to make more energy. All of a sudden, you are healthier. So I hope, as you can tell, I love medical mechanisms. So I hope that answers that. Oh man, we are here for 1.5 hours. Elizabeth says, you're so beautifully animated in front of a live audience. You might consider doing shorts of some of the Q and A's with these chit chats. The heat shock proteins are so great. Absolutely will do. I have taken so much of your time. I would love to give you value back. And that's why plus when I talk medical mechanisms, I get animated. Tom Heavyland 10 says, would you be interested in me coming on your show to talk about the white fibrous clots that embalmers and vascular surgeons are finding in people's veins and arteries? Tom Heavyland. I will have to do some research myself and then we can discuss that. But thank you for the offer. Beth says, been a nice chit chat. Thank you very much. So I think it is 1.5 hours. Nobody's going to watch it afterwards, even if there are some gems in here. So how about we stop? So I see many questions here, but there are no cues with them. So I do not, I just have to read everything. And that Les says, fabulous answer to a great question. Before you archive, hide this talk, you should clip this Q&A and put it up on YouTube as a standalone, very useful and accessible. Thank you. So we can do that, or I can try to do that. I was thinking of talking about that study separately as well. This was just that I wanted to do some value back to you. And if there is value in the remaining pieces as well, then I can do it. So with this, thank you very much for joining. And I enjoyed being with you on a Friday evening. Have a nice weekend, and I would see you next week. In the meantime, please like, subscribe, and share, because there are more people unsubscribing from the chit chats than subscribing. and, and share as well, and like as well, and maybe put some comments there as well. So, with this, thank you. And there are links in the description to buy Dr. Bean or to support this work. And I would see you next week. Have a nice weekend.